Hello, everyone. Very good afternoon. Thank you so much for joining today's panel discussion planned to celebrate the heart of healthcare, that's our nurses. I'm Varun. I head the hospital success team at Medlearn. Very warm welcome to each one of you in today's discussion. As you're aware that Medlearn hosts a series of industry expert sessions to empower and strengthen the healthcare community through knowledge transfer sessions. Today, we are privileged to have our esteemed panel of experts from various healthcare organizations to discuss the pivotal role of nurses in shaping the healthcare landscape. Thank you once again for being the part of this important conversation. I request Subhashri to kindly play the corporate video just to give you a quick glance of what we are, what we do, and then we can take it ahead. Over to Subhashri.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
Medlearn is a comprehensive learning, training and skill development platform incubated at Impel SIS in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with Medlearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. Medlearn. Better prepared for better care.
Thank you, Subhashri. Now, I would like to request Mr. Deepak Sharma, CEO and co-founder of Medlearn, to kindly introduce the moderator of today's discussion. Over to you, Deepak.
Thank you so much, Varun. It's indeed a privilege and honor to have so many distinguished panelists amongst us. I think I'll leave it to a moderator to introduce everybody, but a very warm welcome to all the nursing leaders on the panel, Punita ma'am, Deepa ma'am, Judith ma'am, and Lima ma'am. Of course, Mary from Medlearn, our own internal expert. So without further ado, let me introduce the moderator for today, a very distinguished nursing leader in the country, Ma'am Punita Singh, who is an APP nursing at the HCD Hospital in Bangalore. She's a qualified professional with more than 30 years of experience in various capacities in the nursing roles. She has leadership experience in reputed organizations in nursing admin, clinical training, quality assurance. She's contributed towards clinical excellence, operational excellence, service excellence, business excellence. That she's currently working as Vice President for Nursing Healthcare Global, no, for Nursing for Healthcare Global in Bangalore. She's a passionate professional, actively involved in driving nursing quality, patient safety. She's a life member of TNAI, founding member of Infusion Nurses Society of India, which is affiliated to the US. And she's a founding and executive member of ANI, which is the Association for Nursing Executives in India. She's also an executive committee member for various activities of Tamil Nadu Nursing Council, associate secretary for AHPI, Karnataka chapter, member of technical committee QI, and peer reviewer for Elsevier publications. She's presented various papers, including one on quality nursing care in a very prestigious organization, the IIM Indore. And she's published many articles in peer-reviewed index international journals. She's participated as a panelist in Healthcare Excellence Conference organized by the CI in Goa, has been a resource speaker to various colleges, hospitals, and national forums. She's received an award of excellence from the Deputy Premier Health Minister, Queensland, for outstanding services. Won first place in nursing induction, which reduced attrition by 11%, awarded by NHID. She's also received an AHPI Award for Nursing Excellence and was conferred the Asian Best Researcher Award in March 2024. That's a long list of achievements. Congratulations, and very, very privileged to have all of you on board. Over to you, Punita, ma'am.
Thank you so much, Deepak. Now, I don't know whether we are going to ask the panelists to come on video as they speak. I think it is my responsibility to come on video as well. Once again, let me wish all my dear fellow nurses a very, very happy Nurses Day. I congratulate MedLearn for organizing such a beautiful panel. And, this is indeed, a great opportunity for all of us to connect. We all know by heart by now what is the theme for this year, and I'm not going to go into the depth of it. But let's, as nurses, understand that, we contribute a lot to the economy, of this country. Just imagine a healthcare world without the nurses. Like, I don't even think that such kind of world would ever exist. And, when we are looking at it, actually, the nurses also contribute a lot to preventive health and also timely counseling in the community setup, which in turn contributes to a large extent to the country's economy. And for the nurses to get their due recognition, there are a few things the management, I think, has to look into, by acknowledging the nurses as important and vital members of the ecosystem, and recognizing the value of nursing services. Every hospital has nursing services, which is headed by a nursing head. But how many such hospitals really, really value the nursing services? So they need to value the nursing services. And the management has to empower the nurses today so that we'll have a strong workforce of nurses tomorrow. And also promoting a culture of appreciation, which needs to be there. I think these are some of the very, simple things which does not, require any investment in it, but then the return is going to be really huge and tremendous for the healthcare world if only they learn to recognize us. So we as nurses, let us celebrate us and, for the invaluable contribution that we are making day in and day out to healthcare. So without much, ado, I would like to introduce all the panel members, one by one. So let me have the pleasure of introducing Deepa Annie first. Maybe Liz, your team member can, Subhashri can actually put the video. So she is Senior Manager Nursing in Motherhood Hospitals Pan India. She has 24 years of working experience in nursing and worked as nursing superintendent for the last 4 years. She has also worked with ADK Hospital, Maldives, MS Ramaya Memorial Hospital in Colombia, Asia Hospital in Bangalore. She's the anchor person for the nursing functions in terms of the training and education, nursing recruitment, engagement activities, and implementing and tracking nursing quality indicators. We extend a warm welcome to you, Deepa.
Thank you. Thank you.
The second panelist who we have is Lima Matthews. She is currently the nursing superintendent of Ramaya Medical College Hospital, Bangalore. In fact, when I was just going through her, profile, I just felt that I was so intrigued by it. I told her that I need to connect with her, after this program, because I think she's one person who's so actively involved in, developing various, initiatives for the nursing fraternity. She's a postgraduate in nursing with gold medal as university topper in healthcare and hospital management under IGNOU. Lima is also pursuing her PhD in nursing in allied health science, rather, exploring specific guidelines on nursing manpower. We really need to connect on this, Lima, and I'm sure we will do it. She's presented many papers in various national and international forums, including the award-winning paper presentation on green documentation and at International Patient Safety Conference, which was conducted in Hyderabad, and MedRecon 2020. She received the Best Paper Presentation Award at VICON 2024, international conference conducted by Venus Society of India at Mysore, and won a poster presentation on healthcare communication, CAHCON 17, and propagated the new idea of VICRA for effective communication. Lima led various projects, and one of the projects, Meraki 16, on service excellence and customer delight, won the Excellence Award in AHMA 2017. She also worked for Nursing Excellence Award by AHPI, and the hospital won the category in 2017. We extend a very warm welcome to you, Lima. You are really, inspiring the nurses, I must say, and really looking forward to connect with you.
Thank you so much, madam.
The third panelist we have with us this afternoon is Ms. Judith Vasan. She's the Chief Nursing Officer of Gleneagles Hospital, Bangalore Cluster. She's a seasoned nursing professional with excellent hands-on and leadership experience in leading nursing in corporate hospitals majorly. She's currently working at Gleneagles Hospitals, Bangalore as Chief Nursing Officer. She won the HPI Award for Nursing Excellence. I think typically, literally, every nursing head who is there in this panel today has won an HPI Award for Nursing Excellence, which is amazing. And also participated in the Manager to Leader program and goal setting program in the unit. Judith worked as a chief of nursing and nursing superintendent in Manipal Hospitals, Bangalore, playing a key role in the new startup hospital at Manipal Dwarka in New Delhi. Her key roles and responsibilities are driving nursing quality by carefully tracking and analyzing the quality indicators and developing strategies for nursing services to improve nurse and customer satisfaction index. Warm welcome to you, Judith.
Thank you, ma'am.
And we have the final panelist. We have Ms. Mary Elizabeth, who is currently with MedLearn, who is a content strategy senior manager, a postgraduate in nursing with 19 years of progressive work experience. Mary has strong operational and administrative clinical expertise in various healthcare enterprises, which are tertiary and quaternary care and super specialty also. She's well efficient with the latest clinical advancement and technology in the field. She served as a nursing superintendent at Cloud9 Bangalore, and Mary also handled various roles at Manipal as head corporate nursing, quality assurance and infection control, lead administrative officer for clinical and nursing operations, NABH hospital internal assessor, and nurse educator. She also served as a nurse educator at Sparsh Hospital, Bangalore, assistant manager, clinical research at Healthcare Global Hospital, Bangalore, and also she worked at Wockhardt Hospital. Now, all the panelists have a huge profile, to be added to them. And I think by reading all those things, I've gone tired, I must say. but I'm really, really happy that, we all are connected today through MedLearn. So I request now Deepa Annie to, present uh, her discussion, and then we will further go with others. And for the team who is connected, towards the end of it, whatever questions you have, please either raise your hand or you can type in the chat box. Okay. Go ahead, Deepa.
Yeah. Thank you, Punita. Namaste. Good evening, all. And I am extremely happy to join for this panel discussion organized by MedLearn with Ms. Punita Singh, the moderator, and other panel members, Ms. Lima Matthews, Ms. Judith Vasan, and Ms. Mary Elizabeth. Let me introduce myself. I am Deepa Annie Kuruvilla, heading Nursing Services of Motherhood Hospitals Pan India. I would like to give a short brief about my organization. Our organization, under the company name AHH, Asia Healthcare Holdings, and under this company, Nova IVF Fertility Hospitals, and the Asian Institute of Nephrology and Urology at Hyderabad. And I would like to extend my heartfelt gratitude to the MedLearn leadership to provide this opportunity to participate in this platform. And happy to inform you all, we nurses of Motherhood Hospital are using the MedLearn, the digital learning platform. To the nurses, belated Happy Nurses Day wishes to all. As we celebrate Nurses Day this year under the theme, Our Nurses, Our Future, the Economic Power of Care, I would like to extend my heartfelt appreciations to each one of you. Your commitment, dedication, and resilience are not only shape the present, but it also lay the foundation of a brighter future in the healthcare. Why the ICN has chosen this year the theme, the economic power of care? The economic power of care, reminding the world, I think reminding the healthcare industry to change the social perceptions on nursing workforce. Nurses must be valued, nurses must be protected, and nurses must be respected. Reminding the world and the healthcare industry on the need of investment in nursing workforce, it will give an immense economical and societal benefits. A robust and effective nursing workforce are not only improving the patient outcome, but it also enhances the well-being of an individual, community, and the society at the large, and we are the reason for that. By nurturing nurses' well-being, how? Strengthening the leadership potential, ensuring the financial stability, fostering the emotional intelligence. It can cultivate a nursing workforce that is resilient, empowered, and capable of driving a positive change in the world. Thank you.
Thank you, Deepa, for this beautiful talk on how a nurse can drive a positive change in the world. Thank you so much. Lima?
Yes, madam.
Yeah, go ahead.
Thank you for giving a very great introduction for all of us. And good evening to each one of you, especially mentioning MedLearn admin, as well as all the other panelists and Punita ma'am. Thanks to MedLearn for giving such an opportunity for us to speak about nursing and how to bring up nursing to the level what we expect in India. So as Madam Deepa told, I feel in every Nurses Day, it's time for us to talk about our achievements. Usually we talk great about Nightingale, of course, that exists, but I think what she also intended is her followers have to take it forward and speak about their achievements. So I'm glad to say that just we have finished our Nurses Day celebration in our hospital. So, and luckily as a gift, we have received our nursing excellence certificate just 2-3 days before. And just as a mini exhibition, we have done our certificate handover in that particular forum.
where all the healthcare professionals are there, because Ramaya is like, it's a university. We have various other specialities and other management courses. So in front of everyone, we were able to handle that. Why I am telling this, I am not boasting about the institution or where we are. This is all because it happened because of the nursing team or the nurses who are working with us. So realizing the fact that we have efficient hands with us, only thing we should have strategies to utilize them, to empower them, and to create a power of care. Nurses as the power of care, and thus we should be able to convince the management or the topmost topmost management people, showing that nurses are capable and efficient to take up the initiatives in the hospital, which can be leading towards a better patient outcome. So keeping a note of this, I would like to add that when we talk about the economic power of care, first we have to think about how nurses can be a power of care in the place where we are working, where you will be working in the organization. We should be able to exhibit that we are the power of care. And if you invest onto nursing, of course, it is a real investment to the quality of patient care, and it's not mere a cost. So I will be listing certain strategies which I have learned from the industry, from other hospitals, and which we are trying to inculcate in our culture also. So especially mentioning, like, one of the strategies can be is to build up the scope of service of nursing within the hospital where you are working. Rather than constraining nurses only onto the direct patient care, we have to expand our roles. Recently, what is the trend which we are seeing is in the corporate sector or in many hospitals, like patient care coordinators are there, where the nursing or the coordination activities are being taken up by those people. Rather than that, recently, one step which we have done here is we have taken our own nurses who are interested into administration as patient care coordinators, giving them a role rather than a direct patient care. They will be involved in a coordination where the system will run more smoothly than we expect from the other professionals. So this I have personally experienced, because our own nurses who have worked in the bedside, they were being taken as patient care coordinators. So they are already into the system. They know what are the issues which is happening in the hospital. So they are able to act much more in a beneficial way when we consider the other people. So being a university, to motivate this culture, we are encouraging our nurses to go for certain administration course within the campus. It's like a part-time courses. They will be taking up certain administration courses. We have IGNOU courses here. So to give them or to upgrade them in the administration skills. Same way, we can also create certain specialty nurses into the hospitals, like where we talk about as task shifting and the task sharing. In some of the hospitals, PICC line insertions will be done by the doctors. So what we can do, there are hospitals who are getting trained, who are getting the nurses trained into PICC line insertions, and they are taking up the role. This is how we can expand our roles. Rather than constraining ourselves into the direct patient care, the nurses has to come in various roles so that the value also increases. Rather than thinking about, okay, this is not my job, let me look onto my job a lot. But there is a point when you give the task sharing, when you do the task shifting of this work area, of course, it should be associated with some sort of financial benefit to the nurses, so that it will motivate the team to undertake this. Especially in India, what is the problem is like multitasking, we make them to do, but ultimately we are not able to pay them for what they additionally do. So it can be a better strategy, which I felt. Another example which I can tell is like nurse educators. We have, for a hospital who is NABH, JCI or nursing excellence, they need more number of people for training, 3, 4, 5 members maybe, depends upon the bed strength. It is not financially okay for the organization to have that many number of nurses and increase the manpower. So one of the best economical strategy is like we can have champions from various processes and pay them on some basis, like some allowance basis, for taking up the championship of that particular process apart from the bedside. bedside daily routines. So again, there will be a question comes, how can we manage our daily shift duty along with the championship? Is it really practical? It is practical. How means we can have a rotation basis for championship roles, because usually nurses will be having 3 shift duty. So it may interfere with their roles into champions. So there can be ways like we can keep our nurses on to various shift duties. Maybe one nurse, one champion may be doing for a general shift in 1 month, whereas the other champions will be going for a round the shift program in that particular month. So at least one champion of that process will be available in every month. So that is like an internal. Why I'm talking this is mostly when multi roles comes, dual role comes, this is our practical issue. The work is getting, it's not getting fulfilling the requirements of that particular work, what they are doing. So this is one of the way. Likewise, hospitals are appointing lactation nurses. So lactation nurses can be one among the nurse. We can get them trained and under IYCF. IYCF is it's a certified training for lactation nurse. So they can also provide the counseling and consultation. And that consultation is also incorporate. They are taking a payment for a particular consultation. So this is usually done by hospitals where doctors are doing it. So these all tasks can be shifted to the nursing, which increase the value, as well as we should be able to have certain financial benefit for our nurses so that people will feel motivated. Yes, let me go for a higher course so that I can be a specialty nurse. Those many nurses don't want to remain like bedside nurse. So what they choose is either they will go abroad or they will be taking up a choice for developing a choice for being in the college. So College of Nursing. So rather than that, let us open an opportunity for our bedside nurses, giving them a chance for getting them trained in some particular process, developing them a specialty nurse and paying them a little bit allowance, at least as a startup. So the cultural change starts from one point. So what I thought, that is what I'm trying to do, to have a change in that vibe, so that vibe will be spreading everywhere and we can take it forward. Likewise, similar examples like I can tell critical care nursing courses through which nurses can be trained as specialty nurses in critical care areas. And we have opportunity to keep this critical care nurses as rapid response team members. Many hospitals run the rapid response team only with the trained nurses. So they will be the first contact person when a patient deterioration is happening. So this also increases the value. They are one step ahead than that of the bedside nurse. That is how we can improve our nursing level in the hospitals. But ultimately, to convince management or convince the stakeholders, it's a challenging task in India. But what I feel, if we are able to exhibit the efficiency and your achievements in the initial stage, it can be a road for us to take it forward. At least that organization where you are working, let the stakeholders think, let's see how well it will run if I'm investing onto the nursing department. So I have many other examples like process champions. I have told we were able to develop certain process champions. This is in what about which I have explained to you before. We are putting them onto the rotation basis. Like in this month, they may be like a bedside nurse, but next month one person may go for a general shift to have more implementation of process champions, work-related activities. And expanding our work areas to, as I've told earlier, patient care coordinators can be one particular thing. Another is like a cord blue trainers. That is one more area which we have developed here. Nurses are like cord blue trainers. We have made them AHA. They have undergone AHA trainer program, and they are the people who are training the nurses, not only the nurses, but also the other organizations. Our nurses are going as trainers. So they are getting a financial allowance for that. So this motivates them. They also feel that value when they present in front of doctors. I'm glad to say some of the nurses are taking classes for PG doctors. This is where their image is also getting higher. So these are some examples which I can share, which is best from the industry, through which we can take up their values up and we can be the power of care. So first task is to become the power of care, and next, once we are power of care, it itself will give a red signal or a green signal to our stakeholders. Yes, let's start invest onto nursing and see how well they are able to. So with this, if any other points, if any other panel members can point means can put forward with some examples, I would be glad to hear. Even I am also ready to learn from you. Thank you so much.
Thank you, Lima. As always, very inspiring. I think you've done a fantastic job in your hospital. You spoke about the importance of increasing the value for the nurses and also increasing the financial support in terms of giving incentives or allowances by increasing the value. And your strategies are really great. It's wonderful where you're, kind of shifting your nurses from nursing into care coordinate care coordinators, or moving them up in the ladder, both laterally and parallelly. And also, you talked about nurses doing administrative courses and also specialization programs, and nurse-led clinics, like where they can do the pick lines and all those things. I think most of the hospitals, we already have all these things, but the hospitals do not have it. These are fantastic initiatives for the nurses. So I encourage you guys to do it as well. May I now request Judith Vasan, to for the panel, so that we can just finish off with Mary Elizabeth as the last person. Yes, Judith, over to you.
Good evening, ma'am. Good evening, everyone. And I would like to thank the MedLearn team for having invited me for this panel discussion today. So the topic for today's discussion is related to our Nurses Day of 2024, Our Nurses, Our Future, the Economic Power of Care. So coming to the nurses, the economic power of care, it is like creating healthy people and driving healthy economics. So nurses are often recognized for their compassionate and holistic approach to healthcare, but its economic impact is also very significant. Nurses are not just caregivers, they are the economic drivers who play a crucial role in one, promoting health, two, preventing illness and managing chronic conditions, thereby reducing healthcare costs and improving overall economic productivity. Therefore, nurses work also tirelessly to educate individuals, lifestyles, disease prevention, and early detection of health issues. So by promoting healthy behaviors and empowering individuals to take control of their health, nurses help prevent costly medical interventions and reduce the burden on healthcare systems. So that's why we also have the medical tourism, where we not hospitals, but also we entertain, and also we are very much important in the caregiving of international patients. So more of international patients are heading towards India, and we, the nurses in India, cater to their needs at the bedside, and they take home the message of a greater patient care at the bedside by the nursing team in India. Nurses are also the forefront of chronic disease management nowadays, and providing ongoing support and education to patients with complex health needs through the nursing practitioner program also, which is offered now in India by some of the universities. Through their expertise, nurses help individuals better manage their conditions, reduce hospital readmissions, and improve health outcomes, ultimately saving healthcare dollars and improving productivity. So I can say vital member of the interdisciplinary healthcare team, collaboration with physicians, therapists, and other healthcare professionals who deliver comprehensive and cost-effective care. Expertise in coordinating care, managing the resources, and advocating for patients ensures that healthcare resources are used efficiently and effectively, further contributing to the economic stability. So the nurse who is actually near the patient 24/7 acts as a very significant advocate in the care of the patients. So coming to the problems, like societal problems which nurses face, is they find like often face significant financial constraints and societal undervaluation. So nurses are frequently undervalued, and their contributions to patient care, health promotion, and disease prevention are often overlooked or taken for granted. This under-evaluation needs to be addressed in order to recognize the complex skills and expertise and dedication which the nurses provide. And in the healthcare system, it often results in inadequate funding for nursing education, training, and staffing levels, which needs to be looked at all levels. So the limited resources for professional development, career advancement opportunities can also hinder the ability of nurses to reach their full potential and contribute effectively to the healthcare delivery. So this really has to be looked into. What is the career opportunity which the hospital can provide to our nurses, internally and externally? So furthermore, the gendered nature of nursing, with the majority of nursing being women, it also exacerbates societal undervaluation and financial constraints. So these challenges requires a multifaceted approach that involves the policymakers, healthcare administrators, educators, and society as a whole. It is essential to also raise awareness of the critical role of nursing in healthcare and advocate for greater recognition and appreciation of nurses, as Punita ma'am was also saying, whether it be small or big. Additionally, also they must prioritize investment in nursing education, training, and workforce development to ensure adequate staffing levels, promote job satisfaction, and improve patient outcomes. We in the hospitals do a lot of surveys in order to promote job satisfaction and to improve patient outcomes, but it has to touch each and everyone's heart and lives. This includes diversity and inclusion at the workplace, addressing the pay disparities, and providing support for career advancement and leadership development for the nurses. So next, coming to the reshaping of the perceptions and demonstrating how strategic investment in nursing can bring considerable economic and societal benefits. Number one is always education and training. So investment in a skilled and competent workforce, increasing the funding for nursing schools, scholarships, and also continuous education opportunities. So we are speaking about a lot of training, which is there in India and abroad. But how much of our hospitals really look into the sponsorship of those programs? So that has to be even looked into. Workforce development is another area where strategic investment in the workforce development can really address the shortages and maldistribution of nurses. This may involve like incentivizing nurses to work in rural or remote communities, expanding residency programs, and supporting career advancement opportunities. Third is technology and innovation. So investing in technology and innovation can enhance the efficiency, effectiveness, and quality of nursing care. So how can you do this? You can implement electronic health records in nursing, telehealth platforms, which we have already used during COVID-19, and the digital health solutions to streamline workflows like the nursing care plans, improve communication, facilitate remote monitoring, and patient engagement. So the world is moving towards embracing technology and innovation in nursing practice and optimizing it, increasing productivity, and improving patient outcomes. The fourth is interprofessional collaboration. Without collaboration, there is no teamwork. So interprofessional collaboration and teamwork can optimize healthcare delivery and improve patient outcomes. This involves like fostering partnerships between nurses, physicians, allied healthcare professionals, and community stakeholders to coordinate the care, like how the previous speakers were also saying, and also share best practices, address complex health needs comprehensively. So we should not be working anywhere in silos. So we have like an oath where we say, first to know, first to resolve. So we should work as a team and not as in silos. So coming to research and evidence-based practice, it is essential to advance the science and knowledge base of nursing, which includes funding for research studies, supporting research infrastructure, and promoting dissemination of research findings to inform clinical practice and healthcare policy. So we do a lot of research in nursing, at the various levels like MSc, PhD levels, but the dissemination of research and evidence-based practice is missing at various levels, which will significantly improve the knowledge and help in the nursing growth. So by investing in research and evidence-based practice, we can drive really innovation, improve clinical outcomes, and address pressing healthcare challenges. So the last is the role of policymakers, healthcare administrators, and the general public in return of investment that adequate funding in nursing can provide. Number one is the policymakers. So the policymakers can really influence in the advocacy, whereas it is the powerhouse to shape the healthcare policy, allocate funding for nursing, education, training, workforce development, healthcare delivery. Next is the legislation. There should be enacted of legislation to support nursing workforce development, improve working conditions of the nurses, and enhance patient safety. This includes measures like increasing funding for nursing education programs, establishing loan repayment programs for nurses in underserved areas, implementing staff ratios to ensure that safe nurse-patient ratios are present. Regulations like regulatory frameworks to ensure quality and safety, and also involve licensing requirements, scope for practice regulations, and standards for nursing education and training programs. Coming to the healthcare administrators. So the healthcare administrators should concentrate on resource allocation, like allocating within healthcare organizations, like staffing, equipment, and infrastructure. We can also prioritize nursing by investing in staffing levels, professional development opportunities, and technology to support nursing practice. So coming to the workforce planning, the healthcare administrators can engage in strategic work planning to address the nursing shortages or any maldistribution and turnover problems. This may involve forecasting future workforce needs, implementing recruitment and retention strategies, and fostering a positive work environment for nurses. Next is coming to quality improvement. Healthcare administrators can support quality improvement initiatives, which may include evidence-based. I was always telling you, research and EBP has to be shared, promoting interdisciplinary collaboration and monitoring performance metrics related to nurse-sensitive indicators. Coming to the general public, again, the general public being an advocate for nursing, supporting policies and initiatives that prioritize investment in the profession. It is not only the general public supporting the nurses during COVID-19, but it should be a continuous process. It may involve contacting the elected officials, participating in grassroots advocacy campaigns, raising awareness about the importance of nursing in healthcare. Then coming again to the general public, it is the consumer awareness. So we have to create and educate about the role of nursing in healthcare and the impact of nursing on patient outcomes. The consumers can advocate for high quality nursing care and demand accountability from healthcare providers and policymakers. Last is the community engagement opportunities. So the public can engage with the nursing organizations, healthcare institutions, and community groups to support nursing intervention in health and wellness in their communities. This may involve like something like volunteering, participating in health promotion activities, and providing feedback to healthcare providers, which we normally take inside the hospitals. But we have to even increase our scope to the community, which we will have a greater impact and a greater support public. So thank you once again for the opportunity. Thank you.
Thank you so much, Judith. I think a little bit of, the precepts, what I could gather from your speech is that, investment in training and development of nurses, which needs to be looked into to address the disparity of workforce management. And also, you were talking about the undervaluing of nurses, which need to be addressed. I have seen, this in many organizations. Even mine, I should say. the nurses or the nurse leaders with so much of enthusiasm, they work on the evidence-based practices, right? But these are just considered as value add. There is no financial impact, although it matters a lot to the patients. It is just added as value. It's just looked at as value add. I think we all must, start looking into it as to how we can look at it in terms of revenue generation. Nurses with finance involvement, definitely the organizations will start looking at us differently. So thank you so much for speaking about the importance of nurses and also their economic contribution. Thank you, Judith. And the last panelist for today is Mary Elizabeth, and I welcome Mary. Mary, you can give your speech.
Thank you so much, ma'am. Very good afternoon. I would say good evening to everyone. Thank you so much, Madam Punita, and all the panelists and my fellow Medlon, the colleagues out here for bringing up this program. We've had very insightful information shared by all our nursing leaders and our moderator, Madam Punita. Now, this brings me to a tricky situation. So how would I bring in my points is something that I'll have to focus now on. So I would stick on to the 4 key points what the International Council of Nurses brings in for today. Our nurses are future, the economic power of care. The statement itself proves and speaks loud, saying we are the largest workforce in the healthcare industry. Therefore, we can raise our hands proudly and say that we are also the economic contributors to healthcare industry. This, I would say, big realization is something that every nurse from the time of them being students should be, this point should be driven deep into their mind that we contribute as the economic power of care. If this big health force in the healthcare industry is not strengthened, then like what Madam Punita said, we can never even imagine what would happen to humanity, right? So nursing is evergreen. So till the time humanity or mankind exists, we have our service given to them. Therefore, we have a lot of opportunities to upgrade ourselves, build ourselves, prove to the society time and again that we stand as the strongest workforce in the healthcare industry. Coming to the focus of today's discussion, the key highlights: nurses, the economic power of care, creating healthy people, societies, and driving healthy economies. The exact definition of empowerment or the economic power is a country's ability to invest and upbring the living standards of its citizens. So a country has to aim always at upbringing and building up the living standards of its citizens. When you talk about citizens, healthy citizens are always important, because only if you have healthy citizens can the wealth of the country build up, can the natural resources of the country be utilized, can the superior technology in the country be utilized, and we can stand out as an exemplary country in the globe. So talking about citizens, their health, their well-being matters a lot. So who do you think contributes to the well-being of the citizens or people of the country? It's us, and I proudly admit this, and my fellow nurses here, seniors, my fellow nurses, and the juniors out here also would definitely agree. We have ups and downs, we have challenges, because without challenges, without ups and downs in our life, we cannot keep going. And also, a straight line in an ECG just says that we are not alive. This is quote and unquote from Sir Tata, Ratan Tata. We would have ups and downs. Therefore, how would you face a challenge? One is accepting the challenge that comes in your profession, right? So let's focus and understand how nurses in different roles contribute to what is called as economic power of care. Starting from the delivery of patient care or the clinical care. That is the fulcrum of nursing care. Any nurse on the bedside brings to what is called as promotive, preventive, and curative aspects of healthcare of a patient and also their family. When we talk about healthcare of a patient, it involves the family as well, especially when you talk about The patients, think about a pediatric patient. I wouldn't say pediatric alone, any patient for that matter. It's a family that gets involved from the beginning in terms of decision making, in terms of contributing to the healthcare and recovery of the patient. Therefore, the bedside nurses form the fulcrum. They contribute to enhancing and preventing and promoting the healthcare of patients. Next, I would talk about the educational or the academic side. We have nursing leaders who head the academics. So they hold a bigger role in building nurses as future empowered healthcare nurses. So they would contribute to an empowered society and they would act as the economic power of care. Therefore, the academic leaders in nursing play a very major role in upbringing the nurses of future. Third, nursing leaders, as I said, the clinical and the academic leaders contribute a lot because they stand as an example, they lead as an example, they walk their talk, I would say, in building nurses clinically stronger in terms of leadership. And also they motivate the nurses in every aspect by providing them the right opportunities. I would touch upon each of their role further in my discussion. So they contribute in all these roles like what I have mentioned, and therefore they prove that they are the economic power of care. It's said, and we need not have a debate here. The second point is, despite being the backbone of healthcare, nurses often face a financial constraint and societal under-evaluation. So I call out to all the nurses here. How many of you feel that we are empowered? So I put my hand and say that, yes, I am empowered in whatever role I have worked so far and I'm presently working, right? So this confidence needs to come in each and every one of us. Empowerment is always looked at in two aspects. One is structural, and then the other one is functional or the psychological empowerment. One has to be feeling empowered every day when they step into work. Okay, whether you're working in the hospital, whether you're working in the college or school of nursing, whether you're into a nursing leadership role, or you're into a level of policy making and decision making for healthcare. Feel empowered, because if it is not self-driven, if you are not confident of what contribution can you give to the society, you will not be motivated. Even if you have n number of motivators around you, even if you have an empowered environment around you, facilities, money, man, and resource is not going to motivate you. Therefore, the first factor to all my young nurses here, I would say, is feel empowered, right? And then you can move ahead in the journey. The second is the importance of nursing leaders, I would say. Before I talk about the nursing leaders, I would go back to my nursing professionals here, saying, how would I decide on empowering myself? First, when you get into any role, right, identify the opportunity. So do not wait for anybody to come and give you an opportunity. Whether you're a bedside nurse, if you have a technological innovation, you have a new equipment that's coming in, you have a new procedure, you have a new scope of service that's come into your hospital, you will have to be self-motivated to go and understand about it, inquire about it, learn about it, right? So you'll have to empower yourself with the knowledge, the right knowledge, the skill, and the right professional attitude. This is something I would call the 3 key factors which will always pull any nurse to become an empowered nurse. Whether you are a clinical nurse, you are an academic nurse, or you're a leader, these are the 3 key factors: knowledge, skill, and the right professional attitude. If we do not possess this at any level of our service, then we would not be progressing, is what I would want to say. So young nurses will always have to call themselves empowered. How do you do this? Is first, empower yourself with the opportunities that is available. Prove yourself as a differentiator. Whenever you get an opportunity, always look out for opportunities. You need not, you shouldn't become stagnant. When you're working as a junior staff nurse, you need to grow as senior. You need to grow as a team leader, as an in charge, as a supervisor. Look up to your leaders and grow. Risks are there. You'll have to take up the risks and move on in your profession. Without taking risks, you will not be able to enjoy your profession. So love your profession, love your work. You will definitely have challenges. Keep that prepared in mind that today, yes, I have a challenge. How would I face it? What is the solution? So you'll have to be solution oriented in order to cross all the obstacles and hurdles that come in your profession. Empower yourself with knowledge. Take up additional courses. Take up opportunities. I would like to reiterate on what Madam Lima Matthews has spoken. You get a lot of opportunities in the organization. They call you when they identify that your potential, you are capable. They'll call out for opportunities. You may have an opportunity on the clinical growth. You grow as I said, senior staff nurse, you grow as supervisor, you grow as in charge, or you would grow on the administrative side saying supervisor, grow as DNS, ANS, DNS, and then the NS. Take up such opportunities, because opportunities does not come without you being capable. Trust yourself, believe in yourself, and empower yourself by education, right? As I said, build your knowledge, take up additional courses. You'll have to mentor yourself. Okay, you'll have to take up courses that brings you certification, courses that brings you recognition. You'll have to also mentor your own team members. So growth is always, the best person who could learn is a teacher. A teacher learns it best. A teacher becomes an expertise. That's because they keep on teaching. So you'll have to also build in young nurses. You'll also have to take up mentorship. You'll have to get into a lot of research responsibilities. So if you look into a quality improvement program, you can propose it to your nursing in charge saying, let's take up this quality improvement program and, let's implement this and see the changes that we can bring in our practice. So come out with your innovation and ideas. So lifelong learning is important. Involving as mentor is important. Taking certification and recognition programs is important. Getting into research is important. And therefore, you empower yourself as an individual. Second, nursing leaders. Leaders always lead by example, right? Leaders have to give an opportunity for the nurses to contribute meaningfully to a decision making or any kind of an initiative. Trust is something very, very important here. Trust and give an opportunity. Without giving an opportunity for, I would say, a sports person or an athlete to test the ground, unless a person runs, they wouldn't know their capability. So that you trust, right? You train them, you give them the opportunity, you delegate it, and also you supervise so that they would grow as second leaders. So a good leader always builds and brings up another leader in their team. Therefore, you empower the entire healthcare system, the nursing, the healthcare system empowering the countrymen as well. So we would have healthy people, healthy country. So this is how I would contribute for my own personal empowerment and therefore contribute for the economic power of care, and also how the leaders would contribute. So this breaks that sentence, or it disproves the sentence that, people have society under-evaluates you. You'll have to prove yourself time and again, as I said, with the evidence saying, yes, nurses are empowered and this is the strength of us, right? Therefore, you have stronger opportunities to strengthen yourself financially. The organization will start contributing on the nursing team, the state will start contributing, the country, and therefore the globe will start contributing on the nursing professionals. The third point, reshaping perception, demonstrating how strategic investment in nursing can bring considerable economic and societal benefits. And also the fourth point, role of policy makers, healthcare administrators, and general public in return of investment that adequate funding in nursing can provide. I would only take 2 key points from here, is investment in nursing and the return of investment. I'm sure all of you here, the nursing leaders, the in charges, and all those who have the administrative responsibilities, you have numbers that talks at the end of the month. You have numbers that talks about the nursing performance. You present the numbers to the management business review. You present it to the management, isn't it? So I would say, from the nursing professionals or from the nursing department, start looking out for opportunities. Like Madam Lima, she brought out very, very important points where I also had an opportunity to implement all of these, what she has discussed when I was a nursing superintendent. First, give the assurance to young nurses saying you have a good growth opportunity in the organization, but also tell them that they will have to build up, utilize that opportunity, grow as a differentiator. They'll have to prove that I'm a differentiator, I'm good in my knowledge, skill, and the right professional attitude. This comes from patient feedback. This comes from fellow colleague feedbacks, the nursing in charges feedback, the doctor's feedback, the multidisciplinary team's feedback. So when I am recognized for my differentiator responsibility, I'm a differentiator, I perform very well in my team. Therefore, I become a choice in my organization, right? So this particular person stands as a differentiator in their particular nursing team. So here, the nursing leaders should give an opportunity also to youngsters, and as a team, build up their practices. So the young nurse who gets into a profession, let's say she works as a ward nurse, give them an opportunity to grow as a critical care nurse. There's always something called as floating policy, or we call this as you move the interdepartmental training for the nurses. Empower them with this kind of opportunities. Identify the right people who are differentiators and talented, and this creates a healthy competition. If my friend has got this opportunity, I also get enthusiastic about this, and then I empower myself and seek this opportunity. So have a floating, empower nurses to be trained in different departments, and also empower nurses not only to look into nursing, right? In organizations, I've also seen nurses take up different roles. They get into billing, they get into patient care coordination, where they guide the patient from the time they get into the OPD till the time they get into a procedure, let's say an operation, and also post discharge. The entire cycle or travel of a patient in a hospital is best understood by nurses. Therefore, who else can take up this responsibility well than the nurses? So the different role other than nursing can be given to the nurses. And also, I would talk about the technical, role of nurses. We have technology specialists, where nurses train their own fellow nurses on electronic medical records, the hospital information management system, and also the telehealth. This is all various opportunities that the nurses have. So for you to prove and take up this kind of responsibilities, you need to have proof. You need to work on quality improvement program. When I say you, each of us, right, beginning from the staff nurses in charges, the leaders, take up evidence-based programs. Plan, implement, evaluate, and look for improvisations. Bring it to your management, present it to them saying, this is what we have come up with. Therefore, when this is put into practice, we can see changes in the standards of care delivery. Safe and quality care is something we always look at, and patient-centric care. Therefore, take up initiatives that contributes to patient welfare, right? And prove to your management this is a quality improvement program. So thereby, with a lot of research, evidence-based practices, quality improvement program, you create the opportunities, and therefore you bring the management's attention towards the nursing department. They would be happy to invest, I would say, not always, but then, looking at the changes, looking at the evidence, looking at the data, I'm sure any management would be willing to contribute in this initiative and bring that change. So when you talk about management, it also moves ahead, like saying organization, it moves as state, it moves as a nation. Now, this is self-driven departmental initiative, nursing departmental initiative, how you can bring investment into nursing, and therefore you're already giving a ROI, return of investment, but you can show it to the management. I would also touch upon what is India's initiative, right, towards strengthening the nurses. What are the initiative? So Ministry of Health and Family Welfare in the Parliament has passed the Nursing and Midwifery Commission Bill in the year 2023 for comprehensive reforms in nursing sector. That is, they have collaboratively worked in order to, bring in the states together, the union territories together, to standardize the admission of nursing, beginning from academics. What should exactly the nursing admission be? What should the curriculum be that would help them? Building the competency in the nurses, as I said, interdepartmental training, or we have nurses and midwives. How would you make them more competent, right? And give them more service opportunities, right? How would you utilize the cutting edge technology and the innovation in the nursing educational field? Soft skills training, which is the need of the hour, I would say. Even in nursing today, we need soft skills training and specialized courses and certification. They focus on that, and bringing the global contributors together so that we would also look up to the global requirement. So these are all the contributions which India is working towards. And also they have something called as National Advisory Council and Coordination, which works for education, service, training, and research initiatives in nursing. They bring up different healthcare sectors like, the National Medical Commission, Pharmacy Council, Allied Healthcare Professionals, Indian System, Allied System of Medicines, Homeopathy. All these various department and arenas contribute together to improve what is called as the nursing service standards. So this is the initiative from India, I would say. And when you talk about the global initiative, WHO comes into our mind. Global Strategic Directions for Nursing and Midwifery, SDNM, for the year 2021 to 25. This is an initiative from WHO. Education for nurses and midwives, creating job opportunities, managing the migration of nurses, reducing and retaining the nurses where there is a lot of requirement, strengthening the nurse midwives and nurses, leadership initiatives, academic system improvements, ensuring every nurse is being supported, respected, protected, motivated, equipped in order to provide safe and quality service to the patients and mankind is what WHO is looking at. And they've also got something called as Nursing and Midwifery Global Commission of Practice. This is a virtual network for international nurses, and therefore the policymakers and the decision makers would bring up to the standards of nursing service. So I would end saying You will have to constantly keep yourself empowered with the right knowledge, skill, and the right professional attitude, irrespective of which position you hold and which field of the healthcare you are into or any other industry you are into. These are the three. Therefore, how would you achieve it? Is by constant learning, create constant learning opportunities, prove the achievements to the management, bring the attention of the organization and the country towards nursing, and therefore you create this opportunity to say, to again say, because it's already said, I strongly believe that it's already said, that our nurses are our future and they are the economic power of care. Thank you so much for the opportunity. And at this moment, I would like to thank everyone here and wish all the nurses here a happy Nurses Day. And I would also like to appreciate and thank the families of the nurses. Without the families of the nurses, no nurse would stand as such strong contributor to healthcare, right? Thank you, everyone. Thank you, families. And thank you so much for the opportunity. Miss Lima, not Madam Lima Matthews. If I can know if Miss Lima from
Yes.
HCG is present.
Yeah, Elizabeth, I'm here. Yes, good evening to all of you all. I hope I'm audible.
Yes, Lima. Yes.
Yeah. So this is from HCG and on behalf of Madam Punita. Okay, she had to leave for another meeting. So I'll just take over. So it was a wonderful session and it is so nice that all of you have given a lot of insights into the theme for the Nurses Day this year, like our nurses, our future, economic power of care. Nurses, the economic power of care. So I really would like to think like this is an awesome theme that we have had till now. And there are so many things that we as healthcare organizations, okay, the policy makers, the management should think in terms of investing in nursing. So all the time, nurses were looked into as people who are empathetic, who are caring, who wants to be there at the bedside to deliver care. But also people should understand the importance of investing in nursing. I think maybe the COVID and the impact of epidemic, I mean, the recent COVID which we had, the pandemic which we had, has brought a lot of realization among the healthcare organizations and the policy makers that nursing is inevitable and nursing is very important. And investing in nursing is not just an investment without any return on their investment. So economic power of care is an awesome theme. And what all we discussed today from the panelists, it was a very, very enthralling session for all of us to introspect and understand. So I would like now to ask Madam Deepa. Madam Deepa, like you have anything like to contribute apart from whatever you said? I think like we can give another round over to you, Deepa.
Yeah. We have spoken about the economic power of care. When we talk about the backbone of, nurses are the backbone, heart, brain, angels of healthcare, it's impossible not to highlight the indispensable role of nurses. We are not just caregivers. We are the catalyst for the healthier communities and the stronger economies. So think about it. Our care does not just improve health. It prevents illness, it slashes hospital stays, and even lowers healthcare cost. So how to ensure this happen? It starts with, as everyone says, the investment in nursing education, resources, and recognition. And by empowering nurses with all these tools and support they need, the recognition what they need, we enable them to continue the tireless dedication to patient care. It's a win-win situation, really. To all the nurses, what should I say? I encourage you to keep showing how important and valuable we are in the healthcare. Stay dedicated to giving great patient care. Keep learning and growing in your career and get involved in decisions that affect our work. Work together to support each other, no senior juniors, and find new ways to handle challenges. If a nurse knowledgeable and has expertise in your clinical skills, no one can defeat or undervalue us. And the same way, if you know reshaping, or how we say nursing is not just a feel good move, it's a strategic investment that really pays off. When we put more into nursing education and training, the result speaks to better outcome for patients, and the stakeholders can able to see that tangible return of investment. It's a game changer. Nursing is an asset, not just a cost. We must showcase the significant economic and societal benefits that come from the strategic investment in nursing, and the stakeholders can see that return of investment. And as you say, the policymakers, the healthcare administrators, and the general public, they have to invest in nursing. And to the general public, they have a huge role in this. They have to treat nurses with the respect and appreciation we deserve. Recognize our dedication, hard work, and expertise, and support the efforts by being kind, patient, and understanding to provide the quality healthcare and ensure the well-being of our communities, the nursing communities. That's how we create a world where nurses feel valued, respected, and ready to make a real difference in the world. At the same time, to the nurses, the evidence-based practices. The evidence-based practices always support nurses, and by providing them with a proven effective methods for patient care, leading to better outcomes and increased confidence in their clinical decisions. This approach enhances the quality of care, and it improves patient safety and fosters a professional development, ultimately elevating the nursing profession and ensure that nurses can deliver the best possible care for the society. Thank you.
Yeah, thank you so much, Ms. Deepa. It was very, very well spoken. You had touched on very important points like investing in nursing, okay, should not be taken as a dead investment as return of on investments, and the importance of evidence-based practice, because I think like we have a lot of lacunae or a lag in evidence-based practice nowadays, though we are improving a bit. I think you had given us a lot of insights on that. I would like to ask if Ms. Judith, if you can just tell us what do you think is the scenario of brain drain in our country when it comes to nurses? And do you think as part of policymakers or part of the top management, no, working along with the other stakeholders, how do you think like we can control it, contain it? Is it getting contained? What is your thoughts on this?
Thank you, Lima, for this opportunity. And related to brain drain, I don't think it can be stopped, because I think in all the countries of the world, the Indian nurses are most valued. So we as the nursing heads and the policymakers in India and at the various administrative level or the corporate level, we have to look into how we can prevent this attrition locally, so that nurses in India are able to serve the Indian population at the hospitals. So how can we do that? One, I have already spoken about patient satisfaction and nurse satisfaction surveys. So when we give a survey like without your employment number, and which is a very open survey and it's very confidential, we as nursing heads can know about what exactly are in the minds of the nurses. So when we know what is in the minds of the nurses and it is confidential, we can work on these points instead of being punitive that they have put into a survey certain aspects. So we can look into it. If we are not able to handle it at our level, maybe we can go at the administrative levels of the hospitals, or maybe at the government levels. I was talking a lot about advocacy. So we can go in for advocacy, and certain nurses think that empowerment is just like speaking whatever they want, but that is not true empowerment. So you can be an advocate between the administrators of the hospitals and your nurses. So you can help to come to one baseline where administrators are also happy and the nurses are also happy. So this can, in fact, at least retain some of the nurses who want to be in India, who are very close to their family and they do not want to go abroad. So that type of attrition, at least we as administrators can look into and prevent. And next is, I was already talking to you a lot about training, education and training of nurses. So we tell nurses, usually you have this training, you have that training, this college offers this, we have in-house training, we have online training and all sorts. But as how many of us as administrators have really looked into what is the what is the actual payment and that the administration can sponsor for the nurses? Because I think many nurses, I already talked about, is the financial constraints due to the salary standardization and so forth. So I think as administrators, we also have to be again as an advocate to the administration on what sponsorship these nurses can get, and have a policy like what type of nurses can get these type of sponsorship, how many years of experience they would like to select nurses from the organization, and so forth. We can develop a protocol like this. These are the nurses who we can give the sponsorship to, who will stay with us for n number of years, and all that we can look into. So coming to our organization, Gleneagles Hospitals, we have hospitals not only in India but across the globe, and we have our parent hospitals in Malaysia and Singapore. So what we have done is, in order to enhance the financial status of the nurses in India, we are requesting them to come and do the interviews in India to our own sister concerns abroad. And then we are sending them abroad for a period of 2 years. So when they come back, they will come back with the more amount of knowledge sharing, and they will come here to India back after 2 years with some amount of money which they have saved, which they are happy. They have more experience, they're exposed to the foreign situation. And when they come back, they are really happy and they're ready to serve the organization which really put in strength and power and money to send them abroad. So I think such type of things can help in the preventing the nursing burnout and also making the nurses happy. So there are various strategies like this where we can look into and have a proper policy which helps in preventing attrition and burnout in the nurses. Thank you.
Yeah, so that was very wonderful, Judith, to hear from you as part of the policy maker and the hospital administrator. We got great insight, the way that you are handling and the strategy that you are using. I hope it will be helpful for many of us also. And if at all any hospital administrators are there in the group, in the team, in the participants, I mean, I hope whatever was discussed here is also well taken. We always have all these discussions happening, and it is heard is also another thing that many of the nurses will feel. As part of nursing, I too feel that all this is getting heard, and this becomes, it actually eventually it reflects in the ground reality. So that will be really great. Okay, so now over to Lima. Like we just have 2 minutes for you. I think we're already running late. Lima, can you just tell that you can sum up the whole thing and also tell from educational background or from the nursing education, how can we see that how we can make nursing as an economic power, or what is the bridge or the gap that we have between the educational organization and the hospital sector? Anything which we can do to make it a better nurse prepared, or how can we contribute? Can you speak in that perspective and also to sum it up? Okay, so we'll just have 2 minutes for you and then we will wrap up.
Yeah, sure. So starting from the nursing education, nowadays most of the students are joining the nursing course with an intention that they can go abroad and earn the money. And this is the only course which can help us to be with a job always. So this is the thoughts going among the new nurses and the new group of people, so that they are opting for this course. So how many of them are with a passion, we don't know. So let us leave the word of passion. At least once they are coming onto the course, we should be able to give them an idea regarding what is their opportunity in India and what is their opportunity abroad. So if an efficient nurse, if we are able to find out an efficient student, our ultimate aim should be we should be able to retain that student within India. So if she is from a family of a poor background, of course she will be opting for a job abroad where she is getting more money. So this is where we have to think of. That is where is our economic power of nursing comes into. So at least those who are efficient enough, who is having the thought process of getting excellent in their profession, such people we should be hold up in India, giving them an opportunity to go upgrade their knowledge by various trainings and giving them an opportunity. So I think as nursing leaders, what we have to think, out of our 500 nurses, how many of them are having a passion to upgrade themselves in our profession, to come up in a profession to the next level? At least those people we should be able to identify, and as senior nursing leadership, we should support them, give them an opportunity, handhold them to grow in the profession, so that in the future we will have few more efficient people to lead the profession. So I think that we have to look onto, because future we don't know. When we talk about healthcare system also, we are very much worried how will be the future doctors, how our children will be getting a care as compared to the previous years. These all are our confusions. Similarly, such a scenario is going to happen for nursing profession also. Whether we will be, how many efficient people will be retained in India, who will be taking care of our health? This is always a question. So I think knowingly as nursing leaders, we have to put an effort to find out efficient people who take the nursing leadership forward, trying to handhold them to be better nurses and better leaders. And I wish my every nurses should be like nursing leaders. They have to come forward, do something for nursing, speak for nursing, and show their efficiency. Our people are very much efficient. Nurses are very much efficient. Nobody else will be able to handle the task like how we are handling. That way we are efficient, but only thing we go backward to showcase ourselves. So that is where we have to, once we train them, once we give them the confidence, push them forward to speak for what they have done for our profession, and build up the next future generation of nurses, so that we will have much, this efficiency of nursing leadership should be continued in the future and take up the nursing profession of India to the next level. Hope I was able to conclude all together.
Yeah, thank you so much. Very well said, Lima. Actually, you summed it up very well. And then, as you said, we need to take up the torch and move forward and see that we showcase ourselves. Okay, the most important point, as you said, is showcasing is something which we as nurses lack, though we have all the skills, okay, all the knowledge and everything. We always have the fear, and that is what is pulling us down. So that is really important. And we need to work in hands with the hospital, the education and the hospital sector. We should work hand in hand and see that it is not an independent standalone thing, but then we are collaborating together. Yeah.
Lima, one more point which I missed to tell. See, we always CMC system, the hospital as well as the college is working together. It's like the real teamwork. So even the service side people are taking class in the college. The college teachers, if anybody is remaining as teachers, they are also coming to the hospital and they are doing their hospital service side roles. So that system, if you are able to incorporate in every hospital who are with the colleges, it would help our people to grow and compensate each other. The good tutor may not be a good service provider, but the same way, vice versa. A good service side provider may not be a good teacher also. But if we are able to compensate each other and try to handhold in both sides each other, it will take our profession to the next level. There is no doubt in that.
Yes. Yeah, thanks, Lima. So now, do we have any questions from the participants? The organizers can just see if we have any Q&A posted from the team. Because Elizabeth,
Hi, Lima.
Yeah.
Lima, are you able to see some questions on the chat?
No, we are not able to see anything here in the Q&A or in the chat. Is anybody else able to? Yeah.
Yeah, I guess there are certain questions in the chat box. I can just read out the question and maybe Any of the experts can respond to the question. We'll take just 2, 3 questions mentioned here. The first one is, what policies can be implemented to support the nursing workforce and enhance their economic contribution?
Yes, Ms. Judith can help us with this. What policies? What policies can the hospital implement in order to see the economic security of the nurses?
So coming to the policies as such, it is mainly, if it is coming to the economic policy, is mainly the monetary benefits. So if you have a clear-cut policy on how you are planning the salary for the nurses, right from the fresher level till whether the person is an MSc, BSc or whatever, so that has to be standardized. It has to have a background survey, like how is this salary being given, or to each of these categories, how is it being segregated, and then how is the performance appraisal being done, and how is the increment being posted post the performance appraisal. I think these type of policies, clear cut, it should be with the HR. So that will help in the nurses being happy, at least that the salary is standardized across at least the state, which where health is a state subject, and that makes them at least feel that they are wanted, and whatever they are doing, performing, they are paid for. So that is one thing which we can help out when related to policy making, and also involving nursing in such type of standardization of the salaries will also help in the economic background of the nurses.
Yeah, thank you, Judith ma'am. Like, there's another thing which I want to add on. Like, if whoever has posted the question, okay. So when we look at the pay package or the salary or the policy related to salary, okay, currently compared to the pre-COVID or during COVID, I think there's a lot of change in it. Though we are still coming to reap the full benefit of it, people have understood the importance of nursing, the nurses, okay, and there's a lot of awareness among the healthcare policymakers and the organizers also. When we say pay package, it doesn't mean only the salary, okay. The other benefit when it comes to the accommodation being given free of cost, the food being given, okay, the other benefits, employee benefits being given for nurses, it is being looked into seriously, because when we also look at hospitals across, okay, both corporate and even in the government sector, people are opening their eyes and then working on the policy, and the policy is getting reshaped into what we want it to be. And I definitely hope there will be a long way to go in this. And so the person, whoever is, and this question will be there in the minds of many people. Okay, this is the burning question in the minds of many of our nurses, and I hope your question is addressed to a certain extent, and we can see the difference coming up. Okay, so thank you so much, Judith ma'am, for the answer that you gave. The next question is, nurses are the backbone of the hospital operation. Why do you think the disparity? Okay, so that we finished already. A similar question. What self-care strategies can be implemented by hospitals for the nurses? What self-care strategies can be implemented by hospitals? Can Deepa take the question?
I think for the self-care for the nurses, first of all, how the work environment in the hospital, and how are we providing a hostel accommodation for them? Are we giving the right facility for them? It's matters. And in the hospital, are we providing adequate training, adequate equipments? Are we giving adequate workforce to them? During the shortage of workforce, are we making them to do double shift, triple shift, and how are we taking care of them? That's all matters. And in addition, yes, Lima says the short-term courses of, like, in our hospital, like we have started. Now the current curriculum, the nurses out of the college, they are coming with only the theoretical knowledge. They don't have any technical skills. starting from the thermometer or the BP apparatus, we have to show them and teach them this is thermometer and this is BP apparatus. And in that way, we have to teach them. And after 1 year or 2 year of experience or that learning, then they will go to other places or go abroad for a better opportunity, and the new set of people will come. So these nurses, how are we training them? In addition, their commitment, nowadays I feel the commitment, passion is not there. The people will just come for the job and they will leave. Even for a leadership potential, they don't want that. They want to come for a 6-hour duty or an 8-hour shift, because leadership means they want to take more responsibilities. The new generation, they don't want that. So when we were in that younger age, when we want to become a staff nurse, when we want to become a supervisor, or when we want to become a nursing superintendent in that level, now, I'm not telling all the nurses, but many of the nurses, they will look for more comfort, the work-life balance they want, they are more looking for it. So, see, and one more, the leadership level, if the nurses are good in their clinical skills, what I say, the basic nursing procedure. See, when we do the rounds or many of the hospital, when we visit with our in-laws or with our mother, when we get admitted in the hospitals, the technical knowledge of the nurses, still nurses will do lots of cannulations with unsterile technique, Foley's catheterization with unsterile technique. They are putting the airway on the IV fluid with a pen. So these kind of practices are still nurses are doing because they have knowledge, but because of the lower workforce or the pressure in the workplace may it's creating for them. So how are we making them to ensure, yes, the work environment and with adequate workforce and with adequate training, and if they do a good job, and we have to give engagement activities, like we have to motivate them, we have to support them, we have to recognize them and reward them. That way we can motivate.
Yeah, thank you so much. Very well. You covered all the points. You talked about rewards and recognition. You talked about the shift timings. Talked about the environment, which is very, very important for the young nurses when they board on. You talked about the ratio that we provide in the hospital. So I hope it answers all the questions pertaining to the strategies. The next and the last question for the day would be, what role do nurses play in public health, and how does this benefit the economy? What role do nurses play in public health, and how does this benefit the economy? Yeah, who wants to take this? Anybody? Elizabeth, you want to handle this? Now you are from nursing, hardcore nursing, into various other domains where nurses are flourishing. So you can help us with this question.
So, in terms of public health, I would understand this question if it talks about the primary care and the central care. When we talk about the primary care, in the cities, we do not experience much of it, right? Because the very view of the city's healthcare, going into different healthcare, let's say secondary, tertiary, and quaternary care is what the people out here reach out to in the cities. When we talk about primary health or the public health, especially in the community setup, we have stronger community nurses or midwives in India who take care of the population out there in the villages and small towns. So they are also very strong contributors, because there is very less opportunity for them to immediately get the specialized care. So they are the first person whom a patient would approach. So we also have strong community and public health care in India. So from there, attending to the immediate needs of the patient, whether it's obs and gynae or the emergency care or the medical and surgical requirements of the patient at the primary healthcare level, they're also being referred to the referral centers. And from there, the patient gets the access to the secondary and tertiary care. So there is a strong public health sector and its practices in India is what I would want to say, Lima.
Thank you so much. I think as we always say, nurses are the backbone of healthcare. Okay, that itself handles the question. So healthcare is the backbone of a country's economy, and we are the backbone of the healthcare. So definitely we are the backbone for the country's economy, and government is realizing, and we see that very evident, and we see, as Elizabeth said, the flourishing, like the hospital sectors, right? The quaternary centers, specialized hospitals, all are flourishing and coming up. And this shows that how people are having their mind into healthcare, the importance of healthcare, and eventually the nurses as such. Okay, so thanks, Elizabeth. And I think with that, we end this session. And it was really, really insightful session, and a lot of steps taken by the Medlearn team, Elizabeth and team. Thanks so much, because being not a hospital industry as such, you've taken the efforts to organize this wonderful panel with all the expert speakers over here and the team out there. So it was, I think, it was very wonderful to hear. And the topic for the panel also, like economic power of nurses. Okay, so that was very well done. So thanks everybody, and special thanks to the panelists. Okay, Ms. Deepa, Judith, and Lima, and on behalf of HCG team, okay, Madam Punita and team, I would extend a great thanks to everyone who's joined, the organizers and the panelists and the audience. And wishing you once again a happy Nurses Day and a Nurses Year as well. Yeah, thank you.
Thank you so much, Ms. Lima. That brings us to the end of today's session. So before we conclude, let me share another important information that Medlearn is planning a debate competition, which is planned on 7th June. We would be having a virtual debate competition for the first time. So I request everybody to maximize participation in that, because Medlearn keeps on looking forward to strengthen the knowledge and the skill base of nursing. So thank you all for participating in our insightful webinar on nursing. The engagement and contributions have been instrumental in making this event a success. Each question, comment, and interaction added immense value to the discussion, fostering a collaborative and enriching learning environment. My sincere thanks to all our distinguished speakers for sharing their invaluable expertise and experience. Your thoughts were not only informative but so inspiring, shedding light on critical aspects of nursing that drive the nursing passion forward. To everyone who attended and participated, your enthusiasm and commitment to advancing nursing practices are truly commendable. You can reach out to us on LinkedIn as well. You can follow us on LinkedIn on our LinkedIn page. Let us continue to build on insight gained today and work together towards excellence in nursing. Thank you once again. For any queries or for any suggestions, you can reach out to us on info@medlearn.com. Looking forward to similar interactions in future. Thank you so much and have a great evening ahead.
Thank you.